Hi, Dr Fran here, talking about HPV today. So HPV stands for human papilloma virus. There are actually over 200 strains or type of this virus, and it's really common. It can cause simple problems such as warts on children's fingers, all the way through to more serious things, including cervical cancer. Usually, catching HPV is nothing to worry about because 90% of us will completely get rid of it within 2 years. It can even lie dormant in your cells, so it can't be picked up on a smear, but then we find it again years later. This doesn't mean that a partner's cheated on you, it's just that it can reactivate itself in your body for some reason. So why do we talk about HPV with cervical smears? Because it's what we're actually testing for on a smear. If you don't have HPV there, then we just leave you alone and repeat it in 3 to 5 years' time. However, if we do find a type of HPV which may, over many years, cause a cervical cancer, then we want to check you more carefully. We then look to see if there's any cell changes in the cervix. If there aren't, we will repeat the smear in a year to give your body time to get rid of the HPV itself. If there are cell changes, which could over many years, and I repeat that, over many years, turn into something more serious like a cancer, then we send you for something called a colposcopy, where we actually put vinegar on the cervix to have a really detailed look with a powerful camera to see if there's anything abnormal, and then we might take a biopsy to see if there's any changes which need treatment. Getting a smear test can be worrying and uncomfortable for some women, but we really encourage you to speak to your nurse or GP about ways to make it more acceptable for you, because we're desperate to make sure every woman gets their screening test done. Simple things like making sure you're nice and relaxed, deep breathing, nice music through your headphones can keep you relaxed, which makes it easier for the healthcare professional to pass the speculum and do the smear. If you still find it uncomfortable, ask for plenty of lubricant. It always helps. If you're struggling with the normal size, we can go down and use a really small speculum. And there are even other things we can do. I have one patient who actually goes to hospital to have gas and air or even a general anaesthetic every 3 years to get her smear done. That's how passionate we are about making sure that you get tested and protected.